Thank you for joining us today, everyone. In the Legislative Building in Regina, we have Dr. Saqib Shahab. Joining us by video conference from his home in Shellbrook is Premier Scott Moe. I'll just do a quick check with the Premier. Can you hear us, Premier?
I can hear you, Jim. Can you hear me?
We can hear you. Thank you very much. I believe joining us on the line in Saskatchewan is SHA CEO Scott Livingstone. Both the Premier and Dr. Shahab will have opening remarks, followed by time for questions. For reporters in the room, we'll just ask you to direct your questions over to this microphone so the Premier can hear you. You can stay seated, but just direct your voice there. Premier.
Great. Thank you very much, Jim, and welcome everyone to a little bit different of a press conference, at least for me. And good afternoon. I want to thank you for joining us here today. Let me apologize in advance if my connection cuts out or freezes up. This has happened from time to time over the course of the past few days, but hopefully we're able to get through today without that occurring. I want to begin by expressing my deepest condolences to the family and to the friends of the individuals who have passed away over the past few days due to COVID-19. We're very sorry for your loss. Today, following several days of consultations and on the recommendations of Dr. Shahab and his public health team, we are here to announce a number of new measures and restrictions that will come into play. As always, our goal is to find the right balance on behalf of the people of this province to protect Saskatchewan people from the spread of COVID-19, while at the same time protecting Saskatchewan people's jobs and their livelihoods. Our goal is to not shut down businesses, services, and activities that ultimately put people out of work and at times may threaten their mental health. Our goal is to find ways for those things to operate and to do so safely so that people can continue to participate in athletics and continue working, while at the same time continue to reduce the spread of COVID-19 in our communities. So today, we're announcing a number of new measures and restrictions. These new measures come into effect this Friday, and they will remain in effect through to December the 17th, just like the earlier measures that we had introduced over the past couple of weeks. All of these measures will then be reviewed at that point in time, and they will either be renewed, revised, or removed. Starting Friday, all indoor public gatherings will be limited to 30 people. This includes all types of social gatherings, including weddings, funerals, as well as worship services. No food or drink may be present or served at these events, and capacity will also be restricted to 30 people at all casinos, bingo halls, arenas, live performance venues, and movie theaters, as well as any other facilities that currently have a capacity of up to 150 people. This is just a reminder that the maximum allowable gathering size in your home does remain at 5, and gatherings of any size in your home with people that are outside of your direct household are strongly discouraged at this time. Restaurants, and this includes bars and nightclubs, which are for all intents and purposes today operating under the same accordances as restaurants. So restaurants are now limited to 4 people seated at one table. They must have a distance of 3 meters between their tables. And unless they have barriers installed, in which case a 2-meter distance between the tables would then be allowed. All team sports are going to be paused until December the 17th. However, athletes under the age of 18 may continue practicing or training in groups of 8 or fewer. Mask use will be mandatory for all indoor fitness activities except for swimming. Both individual and group fitness activities continue to be permitted with mask use and at least 3 meters of distance between the participants. Group fitness activities and classes are limited to no more than 8 people. All students, employees, and visitors in schools and daycares are now required to wear a mask except when they may be eating or drinking. And mask use is now required in all common areas of businesses and workplaces. Large retail stores must limit their capacity to 50% or 4 square meters per person, whichever is less. As always, all of the new and existing guidelines and protocols can be found in the Reopen Saskatchewan plan on the Government of Saskatchewan website. I know there are some that are going to ask why this set of activities. Outside of the home, there are activities and venues where we have seen the spread in recent weeks. And it would be great if were able to just pinpoint one or two venues or one or two activities where this spread is occurring and just restrict those only. But the reality is COVID, it's in our communities and it has been spreading in a number of different places, both inside and outside of our homes. And that's why we need to enact a number of different measures to get our numbers under control. I know there's likely an equal number of people that are going to ask, why do you not go further? Why not a complete shutdown or lockdown or circuit breaker? Why not just shut down non-essential businesses and go back to the level of restrictions and closures that we had back in the spring? Well, the reason is this. We do understand this virus better than we did back in the spring. We do know more about how it is spread, and we know what we need to do to reduce the spread of this virus, to keep ourselves and to keep others safe. We need to just slow down a little bit. The overwhelming majority of Saskatchewan businesses and their employees in this province are operating safely day to day. So it would be terribly unfair, and it would have a huge negative impact to close down all of those businesses and put thousands of Saskatchewan people out of work. Yes, that is what we did temporarily this past spring. We took a very sweeping, broad brush approach to shutting down businesses, services, and activities in our communities. Then we reopened with many new guidelines and COVID protocols that were in place. And we were able to operate safely for a number of months by following those very guidelines and protocols that Dr. Shahab had provided for us. And of course, as we all know, over the past few weeks, that has changed and our cases have increased. But we don't believe the solution is another wide-scale lockdown, putting thousands of Saskatchewan people out of work, devastating small businesses and families, ending their livelihoods in many cases. A much better approach for us is to find the right balance, to find ways for us to operate and to do so even more safely than we have been. By ensuring, yes, we are following all of the existing guidelines that are in place, and by implementing some additional protocols so businesses and services can remain open and can do so safely. So that's what we are doing today. By putting new restrictions on some venues, many venues and activities, but trying to minimize the impact on people's jobs and minimize the impact on their livelihoods. The fact remains that regardless of what restrictions or closures a government puts in place, our best defense against this virus is each of our own individual actions. We can all do our part by limiting the number of close contacts that we see each and every day. This means that maybe you don't go out of your home unless it's necessary. This means that you wear a mask when you do go out into public places. This means you adhere to the physical distancing standards. This means you stay home when you're feeling ill. And of course, following all of the other good practices that have kept ourselves and our family members safe. And I know for many, including myself, this can be very frustrating. I know we would all like to think if we just did this one more thing or made one more rule or one more restriction that we could get this virus under control. But it doesn't work that way. There is no silver bullet to controlling COVID-19. There's no one place, there's no one activity that is responsible for spreading this virus. And there's no one practice or one restriction or one guideline that would prevent the spread of this virus. We have to do all of it. And we have to keep doing all of it, all of the time, each and every day. That's what I am again asking every Saskatchewan resident to do. Before I conclude my remarks, I want to say that I was very concerned and frankly quite troubled to hear the Prime Minister's comments yesterday, that Canada may be at the back of the line when it comes to receiving a vaccine. This is quite the opposite of the assurances that the Prime Minister has been providing us as Canadians for a number of weeks and even a month or two now. He had previously indicated that when a vaccine is ready, his government has contracts signed to procure sufficient quantities of the vaccine for all Canadians and in a timely manner. In fact, if you go to the Prime Minister's own website, you will find the September 25th news release that's touting all of these signed contracts. And the news release goes, and I say, or I quote, "The Government of Canada has signed agreements with the following companies: AstraZeneca, 20 million doses, Pfizer, 20 million doses, Moderna, 56 million doses." So yesterday, the comments that were made by the Prime Minister were troubling and should be troubling for all Canadians, to say the least. And they raised serious questions about these contracts that have been signed. What are the delivery dates in the contracts? Why would the federal government sign contracts that puts Canada and Canadians at the back of the line? And will the vaccine be distributed to provinces on a per capita basis, as we've been told would happen? And most importantly, when will we start to receive the vaccine in our respective provinces? Yesterday, our health minister, Minister Merriman, was on a conference call with his federal and provincial counterparts, and he asked these very exact questions without any answers. So we will continue to press the Prime Minister and the federal government to provide greater clarity and to do our part to ensure that all Canadians, including those in Saskatchewan, have access to a safe, effective vaccine and have access to one in a timely manner. So with that, I would thank you for joining us here today, and I'll turn it over to Dr. Shahab for some of his comments.
Thank you, Premier. So I'll just go with some specific details. As the Premier mentioned, we had specific measures put in place over the last 2 weeks that we think have had some impact, but not sufficient impact to bring our case numbers down. Hence, the important announcements today to slow things down and spread things out in a way that we can really start trending our numbers downwards. So as of today, our 7-day average of daily cases is at 17.7 new cases per 100,000, and we always look at an average because of daily fluctuations. So even though we've had a few days of lower case numbers, we've had some days of very high case numbers, but our average still is higher than where we want to be, and as our 7-day average this week is around 214 cases a day. So again, we want this to go down. Our test positivity rate in the province is at 6.6, and again, this is something that we have been watching closely. It has gone down a bit, but overall we do want that to trend down as well. And finally, our active case numbers, as we know, is quite high, and at 2,600. And again, that's something that shows the transmission risk in the community and why we then have to slow things down and spread things out. In terms of looking at where people are getting exposed, obviously we aren't having super spreader events anymore, which is good. We aren't having, those gatherings in the home at this point, which is important at this point to bring our numbers down. But when we look at other transmission settings, outbreaks, or single cases, it is very evident that they happen in all settings. But certainly recreational facilities and sports activities do stand out quite significantly. And the challenge there, of course, is that if you have 2 or 3 teams playing, and then children then present as cases within schools, so many schools can get impacted. So right now, that was a primary source of importation into schools through sports activities, and hence the pause there. For adults, playing sports, again, adults getting together, 2 teams playing. If there was a cluster, it would go back to households, it would go back to workplaces where people who played on a sports team were working, which include primary care homes, other health settings, other settings, and then, of course, other household members who also work in other settings. So very quickly we were seeing, small clusters in those settings and translating into importation into many other settings. So, while challenging, I think it is important to have a pause on, sports and other activities. And, I would like to thank all the parents and children and adults who are playing in recreations and really supporting Saskatchewan in pausing for 3 weeks, obviously doing individual conditioning or conditioning as small groups, but otherwise pausing play for 3 weeks so that we can trend these numbers down. And further, the Reopen Saskatchewan guidelines have stood the test of time during the pandemic. They've been very good. But right now, even these good guidelines may not be sufficient to minimize transmission. Hence, there have been some adjustments made to those Reopen Saskatchewan guidelines, either through a public health order or through updates to the Reopen Saskatchewan guidelines. Some of these may be revised once our transmission rates come down. Some of them are just good feedback from industry consultations and may remain for as long as there's a pandemic, because again, these guidelines continue to improve. But again, the main point there is that, we've said this before, that when you're out and about, shopping, go at times that are less busy. I think businesses can also maybe post on the website times that are less busy, so that people don't have to wait outside for too long. And once you're inside, we need to space things out. Obviously, we were doing that very carefully in March, April, and to a large extent that has continued in Saskatchewan. But from other jurisdictions, there's been concerns about crowding, especially when there's a sale. So we really want to limit those opportunities of transmission happening when there's crowding, even in the retail environment. And finally, I just want to say that this is really an opportunity for us all to participate in this and not to look at shortcuts or ways to circumvent this. I think most people will follow these guidelines, but it's just really important for us to stay the course for the next 3 weeks and see our trend numbers start trending down by the middle of December, so that we can look at further options at that time in terms of continuing or even relaxing some of those measures as appropriate. But having said that, if right now our numbers seem to be stabilizing and we want them trending down, but unfortunately if they start trending up again despite all these measures, unfortunately then further measures would have to be considered, which are again very hard to propose and implement, but are necessary to protect the healthcare system, which has come under some stress, and certainly we don't want that coming under additional stress at this point. So with that, I'll just say that I think the basic principles apply. Stay home from work, school, going out and about. If you're sick, wear your mask when you're in indoor public places. We all need to understand and respect the reason for these new regulations and comply with them when we're at a place of business or other setting. And hopefully, with this, we can see our numbers trending downwards. Thank you.
Thank you, Doctor. Thank you, Premier. We'll take our first question from the room. We'll go to Mary Madrick with the Leader Post.
Good afternoon, sir. Isn't it inherently unfair to expect the public and even businesses to police these new rules and regulations if you are not going to substantially increase fines? It would be a little like telling them that we have a traffic problem and not increasing speeding tickets and other measures. Why no decision to look at a way to use deterrence, either from the business standpoint in terms of penalties for exceeding store limits, or from the personal home situation or the mask use situation? Why did you not decide that the government should back what you want the public to do through increased fines?
I would just first, if you have something to add, Dr. Shahab, but I would just first say that the fines that have been administered here in the province, and I don't know exactly what infraction of which public health order you would be referring to, but my experience has told me that the fines that have been administered in Saskatchewan, whether they be to a corporation, which I believe have been in the neighborhood of about $12,000, or whether they have been to an individual, which I believe have been in the neighborhood of about $2,000, are among the very highest in the nation. In fact, I'm not aware of another province that has fines of those levels. I may be mistaken on that, but I'm just not aware right now. So I think the fines are, very severe, and they have been administered after a public health investigation has occurred where someone was blatantly not following the public health advice that has been put out there. Do you have anything to add to that, Dr. Shaw?
Yeah, I would just add that, on a positive note, we haven't seen, large super spreader events or egregious violations, which is very positive. And it really shows that, at a basic level, I think all people in Saskatchewan understand the reasons for, the provisions put in place for the last 2 weeks and the provisions coming into place today. But certainly, and I would suggest that, those individual interactions where sometimes there's a bit of a unhappiness about putting a mask on, when you're going to an indoor public place. I think we just need to comply with that and make it easy for all of us, business owners, customers, other people who may be there, and recognize that this really is to protect all of us, these measures that we all have to take. But certainly, I think if there continues to be any significant violations, that would have to be looked at.
Follow up, Murray?
Yeah, do you really think that a store clerk in a store, when he's not necessarily or she's not getting the support of their employer, is going to tell someone to put on their masks? Or are we going to see situations where we're going to have actual policing within the stores and issuing those fines if they're in excess of the 50% limit that you're recommending right now? There's a tremendous amount of skepticism that this might be just window dressing to sound like you're really doing something, but in essence, it doesn't really come to fruition. So I guess what the public would probably like to know is, how is this going to be enforced? Are you going to be able to provide the backing that employers, employees need to enforce what you think would be effective?
Employees to actually enforce this in their stores. What we're asking Saskatchewan people to do, as we have always done, is to ask them to comply with the public health orders that are being administered, understanding the reasoning behind why they're in place. It's to ensure that we can preserve the capacity of our healthcare system. It's to ensure that we can actually keep the economic sectors, the retail sectors of our economy open. And it's to ensure, first and foremost, that we're able to, in some way, shape, or form, preserve the community activities, athletics, and events that we all want to attend, that I would say, attribute to the very strength of our communities and the strength of our own personal mental health. And so we are asking people to continue to comply with the public health orders that are there. We have had instances where there has been non-compliance. Those have been investigated by the public health team. The fines had been administered, and I would expect that to continue in the days ahead if there is any degree of deliberate non-adherence to the public health guidelines that are in place. For example, by a large retail store that is bringing additional people in to be above their 50% capacity. That is an example of something that public health most certainly would perform an investigation on and administer quite likely a fine if necessary. But by and far, and I think this is important for us to remember, although there have been some instances where individuals or organizations have stepped out of the public health guidelines, and there's been some spread from a few of those instances as well. By and large, the vast majority of Saskatchewan people, Saskatchewan businesses, and all of those community organizations across the province have done, I think, a remarkable job in adhering to the advice that has been provided by Dr. Shahab and his team. And we expect that to continue in the days ahead. And where people are stepping outside of that advice, public health is going to conduct the investigation and administer penalties where they see appropriate. As I would say, the law enforcement officials would as well use their discretion, as they have over the course of the last number of months as well.
We'll take our next question on the phone line. Operator?
We have Ryan Kessler with Global.
Hi, this question is for Premier Moe. Premier, you've ruled out a lockdown or a short-term circuit breaker, but Dr. Shahab said that if there are, if these new measures don't work, then we'll have to look again. How far can we go with reducing activities or reducing limits inside restaurants and bars before we have to do even a short-term, maybe 2-week lockdown just to get the numbers under control and control the strain on the healthcare system? And would you be prepared to provide those businesses with some financial support and those workers if you have to make that decision?
So I would say that we're not prepared to look at a shutdown of our economy and our communities at this point in time. And we don't believe it's imminent that we will have to do a shutdown here in the province. But in saying that, if we're not able to bend the growth and the rate of transmission of this disease, obviously, that is a conversation that may come in the weeks and months ahead. But we believe with the actions that have been taken and the guidance that we've been provided over the course of the past couple of weeks by Dr. Shahab and his team, the actions that are being added to today, which are substantial, that we will be able to not only hopefully flatten the rate of increase of the COVID-19 infections that we see, but actually start to bend that curve back down. In the days ahead, we are looking at, is there a way in a similar fashion as to last spring, is there a way for us to look at supporting some of these industries that are being impacted by the restrictions that are being put in place today. So that is an active conversation in government, but nothing to report or announce on that today. But we will be working with those industries on something similar to what we did last spring. And I would just take this opportunity as well to thank all the industries that we consulted with over the course of the last few days, all of the athletic groups, the worship organizations, everyone that took part with what was a very ambitious, intense, and rapid consultation conducted by our business response team with so many organizations across the province, and really being a conduit between those organizations and Dr. Shahab's team and the public health team here in the province, where we have been able to implement some of their suggestions in what we are doing here today, and most certainly we'll be implementing some of the suggestions that they have should we be able to, on December the 17th or at a later date, start to look at opening a few things, very specific things back up at some point. But we just simply aren't there in many cases today. So we don't believe a shutdown is imminent. We believe the actions that we are taking are going to make a difference, and we'll be watching that very closely in the days and weeks ahead, as I know Dr. Shahab will be as well.
And we'll go back to Adam Hunter for a follow-up.
I've asked this last week as well, but people want to know what the threshold is, how many deaths or hospitalizations, ICU admissions will it take for the government to say, okay, enough's enough?
So, hi. So maybe I can give some initial remarks on that. So I think there's we obviously look at our overall case numbers, and I've said that, our comfort level, we've been very comfortable with less than 5 cases per 100,000, so that's less than 60 cases. Obviously, that doesn't mean we ignore a single case at that level. If there's a cluster and then an outbreak, we manage that very effectively. Anytime we're between 60 to 120 cases a day, but under that 10 per 100,000, we obviously very concerned, and we want to start signaling actions that we may need to take. But anytime we're above that 120 per 100,000 number, especially with a high test positivity rate, we obviously need to focus in on, what is the transmission, what is the response that all of us as Saskatchewan residents can do, what are some policy options available, either through adjusting the Reopen Saskatchewan guidelines or through public health orders. So that, since we have been above that 120 cases a day now for 3 weeks plus, there's been specific measures put in place over the last 2 weeks and then this week. The second thing I would like to mention is that, and we are not unique in Saskatchewan, but testing has been very robust and has worked well for us. Our contact tracing capacity has come under pressure throughout the last 3 weeks in different parts of the province, especially in some of the larger urban centers. It gets better on some days. It gets challenged when there's hundreds of cases being reported on a weekend, for example, that all have to be prioritized in terms of, so that again is a message to all of us to keep our numbers low. Our average number of contacts per case is still 8. We really need to bring that down. And I would just like to say that all of us need to actually, in our workplace, in every setting, we need to actually visualize that if I was to become a case today, who was my close contact in the last 3 days? And we need to go about our daily lives at work, at school, otherwise when we're shopping, that we should be able to confidently say that, I was wearing a mask, I was keeping 2 meter plus distance, and I don't think there was a single person who was a close contact. Now, public health or my employer may still think that no, let's be careful, let's notify these 3 people who you were in with the meeting room, everyone was wearing a mask, but let's inform them to either isolate at home or self-monitor for 2 weeks. That may still happen, but I think it is important for us to visualize that if any one of us was to present as a case today, can we identify the people who were close contacts in the last 3 days? And if we can identify more than a handful, how can we minimize that on a day-to-day basis? I think that is going to be essential. And my last comment, of course, is that obviously we have seen the tremendous pressure that comes on acute care, ICU and hospital bed capacity. Our hospitalizations have been trending up, and at this point, that is being managed. But we have seen in other jurisdictions, not so much in Canada, but in other jurisdictions where that does bring significant pressures, and that is again something we absolutely need to avoid, not just for care for COVID patients, but for care for all the other emergencies, urgent care that's required, and as much as possible to support routine care continuing as well. Thank you.
And we'll take our next question from Stephanie Taylor with the Canadian Press.
Yeah. Mr. Premier, what sectors are you looking at providing financial support for, and when can businesses being hit with these restrictions expect to be able to receive some of this money?
Well, we're working with those sectors right now. I am not going to disclose. There'd be sectors that would be ultimately impacted by the decisions that we're making here today. I don't have a date on when we will be moving forward, or if we will be moving forward with a compensation package. But we are working with those sectors to understand how today's recommendations, and we thank them for their engagement, how today's recommendations are going to impact them, and how we can best support them to ensure that our local small business, our restaurant sector, for example, and others are there when we come out the backside of this pandemic, offering the very same service to the communities that we have come to expect, but also come to appreciate. We must never forget, these are the very businesses that are reinvesting back into our communities with money, with time, investing in our athletic organization, investing in our local fundraisers. These local small businesses are the very heartbeat of our community, and we're going to work very closely with them through what is a very unprecedented time.
Follow up, Steph?
Yeah, it seems that the only real shutdown or closure that's happening here is towards kids' sports. Why is your government choosing to really kind of shut the door for the next 4 weeks on kids playing hockey, curling leagues being able to, go and do their thing, when bars and restaurants will be able to, stay open?
I would just start, Doctor, and I know you'll have a fair amount to add. That simply isn't the case. When you look at the kids' sports, youth athletics will still team-based athletics will still be able to do some of their practices on a reduced level. There'll be 8 people on the ice, for instance, that will be able to do some conditioning, but not be able to play actual games. That is very much parallels what we have done with restaurants, where we have reduced their capacity through ensuring that they have the physical distance. And our bars and nightclubs are operating in exactly the same way as our restaurants are today, under essentially the same set of parameters. Our worship services, reducing their services to 30 people is by no means not a sacrifice for many worship services that are conducted across this province that may be in pre-COVID times in a number of hundreds of people that may attend. And so they may be attending, yes, virtually, but also conducting 4, 5, or 6 services during the course of whatever day they choose to worship on. So there's impacts that go far beyond just athletics and even just youth athletics. There's impacts on our large retail locations, for example, only allowing 50% capacity through their stores at any given point in time. So, youth athletics, we had great engagement. I think Dr. Shahab would agree with the leaders of multiple different recreation activities, and we thank them for that. And we're going to utilize much of that, not only in today's announcement, where we allow them to continue to do some conditioning activity and some skills-based activity, but most certainly some of the suggestions that came forward will be part of any, probably altering any more finite steps in some type of the reopen plan, when we can hopefully in the future start to get back to not only playing our youth athletics, but opening up some of these other areas as well. But the fact of the matter is right now, our numbers say that we need to take these steps. We need to take the initiative here to bend our infection rate down in our communities to ensure the health of our healthcare system, the health of our communities, and ultimately the health of our economy. Doctor, do you have anything to add to that?
Yeah, thanks. So as we look at our individual cases and our outbreaks, we always knew ever since July when sports started that, there may be the nature of play is such that there is a risk of transmission, even if you're following all the guidelines. And there would be occasional transmission events, but over the last 2 to 3 weeks, they were becoming so frequent, and in many cases, they're resulting in, for example, in children's sports, multiple cases then being imported into schools. For adult sports, multiple cases then being imported into workplaces. So it was really important to, have that pause for 3 weeks to, slow down transmission in that setting, and then the secondary effects for schools and workplaces. In many cases, school is so important to have in-class learning, and many of the workplaces are essential workplaces with, in some cases, vulnerable people. But of course, once our case numbers come down, sports are an important part of physical and mental and social well-being. So again, as our numbers allow, again, the guidelines may need to be adjusted a bit, but that will certainly, we hope, will start again once numbers settle down.
And we'll take our next question on the phone line.
Sorry, this is Ryan Kessler with Global.
Good afternoon. Question for the Premier. In July, the National Institute on Aging gave provinces some advice on connecting seniors in long-term care with their families, especially given the current outbreaks and the stress that they would create. We're hearing from some seniors in Saskatchewan who say they're feeling isolated, and some are even to the point where they say they'd rather not be alive than deal with the current isolation measures. So what is the province's plan to ensure that isolation doesn't lead to deteriorating health?
Well, we would hope and we would, support in any way that we can the opportunity for families to visit with their loved ones that may be in a long-term care home or any healthcare facility for that matter, that they would be able to visit, for example, via using the technology that we're using here today. It's not the same, and it doesn't replace an in-person visit for sure, but it most certainly might be in many cases all that we have at this point in time. On a little different note is for those families that do live a distance away, the virtual option is really the bulk of the option that they've had throughout any time. But these are unprecedented times. And I can tell you of all of the discussions that we have had around our caucus table, our cabinet table with Dr. Shahab, some of the most trying decision points that we have come to for myself have been just those around our long-term care homes, our loved ones, our family members that are in those homes, and for not only the health of them in particular, but the health of the entire long-term care home, and ultimately the health of our healthcare system. These measures are necessary. We have seen across Canada, the fatality rates came up earlier. We have seen across Canada what happens to the fatality rates when COVID enters into the long-term care home system, and it isn't pretty. We have been very fortunate in Saskatchewan, and a credit to many long-term care homes across the province, and we need to continue to be vigilant in what we are doing each and every day, so we're not getting spreading that COVID to staff members of long-term care homes or to people that may have an opportunity to visit, hopefully, as we near the Christmas season. But we've been very good. I believe when I checked yesterday, of the 10 provinces, Saskatchewan has the 7th lowest fatality rate of 10 provinces. And I would attribute much of that to the fact that our long-term care homes have not had widespread outbreaks like they have had, unfortunately, in some other provinces. So, albeit these are necessary actions, it doesn't make these actions any more painful for families. And I realize that, I understand that, and it is just probably one of the most unfortunate outcomes of this virus is keeping families apart. Doctor, do you have anything to add to that?
I would agree that I think, there was, throughout the pandemic, there's been a lot of work by the Saskatchewan Health Authority and by the personal care homes to support, safe visitation, and that has worked well. We have gone many, many weeks without a single case in a long-term care home or personal care home. But right now, unfortunately, we have several facilities with the case and some facilities with outbreaks. We are now posting our outbreaks in long-term care facilities online, just as we have for schools. And it is a great concern. And at this point, I think some restrictions are essential to protect the most vulnerable.
Follow up, Ryan?
Yeah, I just want to refer back to these recommendations from the National Institute on Aging. It actually includes allowing visitation during outbreaks. So why not allow, in a very controlled manner, families or one person from a family to visit one resident each, especially when you consider the fact that they're only visiting one person while long-term care workers will visit multiple residents during a single shift, and they might be doing so after being in public spaces where COVID-19 has been spreading.
Yeah, what I would say is that, when we have looked at the experience in other jurisdictions, when community transmission is low, that is fine, and that was happening throughout the pandemic till, recently. But when your community transmission goes up, that results in risks of multiple importations to the long-term care facility. So again, when community transmission goes up, unfortunately, some restrictions do have to be put in place. But obviously, it's a dynamic situation. I think it is being managed in a very local, regional way so far. But right now, because our community transmission is so high throughout Saskatchewan, I think some specific restrictions have to be applied province-wide. But as soon as our community transmission comes down, obviously we can go back to the way you described, which really continued until a few weeks ago, and was successful in terms of minimizing risk because our community transmission was low.
We'll take our.
It's a good example, and I would hope that this is exactly what is on everyone's mind in this province over the course of the next number of weeks as you think about whether you are going to adhere to the public health guidance, the public health orders that have been put in place. This is a hope that we can get to by Christmas time, is maybe we can have some allowable visits, yes, with multiple levels of PPE protection, whatever that might be. But today, we're just not at that point in time. Today, we are at a very different point in time where our rate of transmission, our community transmission is far too high, and we need to lower that if we are to even have that conversation heading into the Christmas holiday season. And I would hope that everyone over the course of the next 2 to 4 to 6 weeks gives this topic some very serious thought each and every day, because this is the goal, this is the target, this is one of the biggest removals of the opportunities that we have in our daily life to see our family members that are in long-term care homes. It's for the right reasons, but nonetheless, it is a huge sacrifice. And if we all just give a little bit, don't go out unless you have to. Wear your mask in public. Do what we can to bend the rate of transmission. It's our hope that our families can once again come together sooner rather than later. This is a good reason for all of us to give second thought to what we're doing each and every day.
We'll take our next question from the room. Mark Smith with CTV.
Since the initial measures a few weeks ago came into effect, we haven't really seen a drop in case numbers. How confident are you that these measures are going to bend that curve in the right direction?
So obviously, our main concern is an uncontrolled surge in case numbers, and we've seen the havoc that can play in other jurisdictions, other parts of the world. It can very rapidly overwhelm the healthcare system. So thankfully, we have not seen that over the last 3 weeks. We think the actions all of us have taken, individually, and some of the measures that were in place for the last 2 weeks have made a difference. But at the same time, the difference has not been enough to bring numbers down. And when we reopened Saskatchewan, we did say we want to give 2 to 3 weeks for each phase, but we will reopen within 2 weeks if we were comfortable. We've learned about COVID that transmission to the next generation of transmission starts in as soon as 5 to 6 days. So in a couple of weeks we can start seeing where the trend is. So that's why, I presented modeling, a while back. We have updated the modeling as of last week using data from 20th November, which again is showing that on the one hand, the measures we have put in place is having a slowing down effect on the rise, but it's not enough to bring us down to a safe level, both for to allow activities in the community that are currently being paused, to allow for low risk of importation to long-term care facilities, to protect the health system. And that's why these additional measures, we hope, are going to have a further downward impact on our case numbers. But again, like the Premier said, the measures and the public health orders are one thing, but all of us then complying diligently with that is what makes the difference. That's always what's made the difference.
Follow up, Mark?
The measures that we put in place some time ago have been helpful. We hope in starting to plateau or at least reducing the rate of transmission that we have. But it also speaks to the reason that we're out here today. Had they allowed us to take a sharp downturn in our transmission rate, we wouldn't be out here today with additional measures to ensure that we can achieve that. The measures here today are substantial. They will have an impact on what our youth and what our athletics organizations are doing. They have an impact on our communities, and they'll have an impact on our broader economy as well. We have tried to minimize that through consultation with those that are working and involved in these sectors. But had the measures that we had taken over the course of the past few weeks worked perfectly, and we think they have made a difference, but had they worked perfectly, we wouldn't be out here today. So we are out here today with additional measures to ensure that we can work together as people across this province to keep our communities safe and ensure that we can head into the Christmas season, into the holiday season with some semblance of an ability to hopefully be able to gather in some smaller groups.
Follow up, Mark?
We've been hearing from people who've waited up to 5-6 hours at the COVID testing sites here in Regina and Saskatoon. Is the SHA considering expanding the hours at those sites to ensure everyone gets tested? Has the SHA looked at the efficiency of these sites since the drive-through testing was open? What kind of plans have been put in place to make sure people who need to get tested are getting tested?
We'll go to Scott Livingstone on the phone line.
Thanks. So as you know, we do have the drive-thrus in Saskatoon, Regina, Yorkton, and we're setting one up in PA. And with respect to the Saskatoon and Regina drive-thrus, they have been very popular since the inception of bringing them on. We're aware of the time frames for waits starting to creep up because of interest in testing, which is a good thing. And we are looking at what we do over the next few weeks and months to come to either expand hours or expand services so that we can accommodate more people getting tested.
And we'll take our next question from the phone.
Well, I think Saskatchewan is still the only province that has their testing wide open, where anyone that chooses to be tested can be tested. I think most other provinces have moved towards just testing those that have been in contact or have been contacted by a contact tracer. So we still do have a more access to testing on a broad population level than, if not all, most other provinces.
We'll take our next question on the phone line.
We have Lisa Schick with CJME.
Hi. Looking at this list of new restrictions, except for the recreation one, putting a pause on that, they almost seem like half measures, kind of chipping away at different things. Mr. Premier, we've heard you talk before about these big jumps in numbers we've been seeing being concerning and troubling, but they're not concerning enough to do more?
I would disagree. I don't believe these are half measures by any stretch. When you're looking at what is happening in restaurants, essentially increasing the distance between the tables by 50% is going to reduce the capacity of those facilities, and then further reducing the number of people at each table from 6 to 4, about a 33% decrease there. These are by no means half measures, and I think any restaurant operator would agree with that. To reduce the number of people in our casinos or in our large event centers to 30 people, by no means is that a half measure. That was 150 people previously, and I would only have to venture a quick conversation with some of our organizers and leaders in our worship services to say that this is going to present significant challenges for them in the short term, but we also feel it's going to present significant results in bending our spread of COVID-19. People are going to be wearing masks indoors, even at the fitness facilities, which is a change from where we have been. So I believe that these measures that are put in place are substantial. They are by no means half measures, and it's my hope, and I believe that they're going to have a substantial impact on our COVID numbers here in Saskatchewan. They're reasonably well targeted to the areas where we are seeing transmission, and they're quite well targeted with respect to restricting the numbers of people that come together and restricting the movement in those particular organizations.
Follow up, Lisa?
Yes. If Dr. Shahab, if there are no super spreader events that we're seeing, just wondering where the Regina cases are coming from, because we seem to be seeing cases specifically in Regina kind of going up by more and more.
Yeah, thank you for that. So obviously, I am in contact with colleagues throughout Saskatchewan on a daily basis, and we all did see that on the one hand, daily case numbers in Prince Albert and Saskatoon have been trending down. That's very good. But in Regina, they have been trending up, and the explanation of that is several settings. There have been obviously multiple events in sports teams and secondary cases in schools. Secondly, there have been cases and outbreaks in personal care homes and long-term care settings that again can be very challenging. And then thirdly, there have been cases and outbreaks in workplaces. So those have been primarily the settings in which these numbers, these cases are presented. And also, whenever there's an outbreak, there's intense case finding that also is very important, like in a personal care home or a workplace. The broader testing may be recommended by public health to find all cases so that they can be isolated to stop further transmission. So that is a very important intervention, but that obviously does increase case numbers to that active case finding, and we've seen that in the past, for example, in Laloche as well.
We'll take our next question from the phone line.
We have Zach Becerra with Star Phoenix.
Hi there, Premier and Dr. Shahab. This is the latest set of measures we've seen in the past month. We saw mandatory masking first in 3 cities and expanded. We saw private gathering sizes dropped from 30 to 15 to 10 and now to 5. And it feels like they've been becoming more frequent and even more incremental with as many exceptions as there are rules. I'm wondering, fundamentally, have we underestimated this virus and this second wave? And if not, why are we having so many rule changes in such a short period of time?
Maybe I can start. So obviously we all acknowledge that the COVID case numbers can rise very quickly, and we've seen that now in Saskatchewan, and we've seen that in other jurisdictions. So we have to be very nimble, but we also have to understand the transmission settings and be proportionate to the rise in case numbers and take appropriate actions at the right time. So, from that perspective, I think being progressive in our restrictions has been important just to manage the rise in case numbers. And again, going forwards, all 3 possibilities would be on the table. Case numbers start trending down. Before the holiday season, there could be an opportunity of some relaxation for gathering limits in the home, for example. If our case numbers don't trend down but stay at this high rate, and these measures may have to continue beyond December 17th. And unfortunately, if our case numbers continue to trend up, further measures may have to be considered. But, in my view, based on the evidence to date, the case numbers, transmission settings, the measures have been evidence-informed and proportionate to the transmission risk. But obviously, this is something that, all of us in Saskatchewan are monitoring closely, as are our colleagues throughout Canada and throughout, North America, Europe, where we are all seeing surges of COVID.
Yeah, and now we watch I watch now, due to the recommendation of Dr. Shahab, but the 7-day rolling average of cases, we're at 214 today. That's simply too high. I think back to, Election Day, which is about a month ago. It'll be a month ago tomorrow. We were at 55. So our cases have increased quite rapidly here in the province, and we have been addressing that with multiple different announcements, restrictions, initiatives. You mentioned a few with respect to the gathering size been shrunk and really brought down to essentially each individual household. Our visitation policies at our long-term care centers has been changed due to the fact that we have a higher community transmission rate and higher transmission rates in general across the province, and it only stands to reason when those rates are increasing to the levels that they are. COVID is going to arrive in our schools and in our long-term care centers, in our workplaces, and in places that we visit each and every day. So as the numbers rise, we have been there to ensure that we are implementing the appropriate measures. If they continue to rise, unfortunately, we will continue to have to make decisions, and Dr. Shahab will continue to make the recommendations that he has over the course of the last 8 or 9 months. And if they are able to fall off to some degree, we may, and only then would we be able to have any discussions around, could we relax things just a little bit temporarily over the holiday season so that families would be able to gather. But they need to fall, and they need to fall quite substantially.
Follow up, Zach?
Yes, thank you. I'd like to ask the Premier about some of his comments regarding vaccines. My understanding is that part of the reason why Canada is farther back in the queue, if you would, is because of a lack of our domestic vaccine manufacturing capacity for the types of vaccines we're talking about, such as those produced by Moderna. The federal government has actually given, I think, $12 million earmarked to a Saskatchewan organization to increase that capacity. They've said that it just takes time to do and that there's no way around it. So I'm wondering I guess I'm seeking to understand why you were so frustrated with the Prime Minister, given that this might just be the reality of our situation.
So two ways to access vaccine in this day and age. One is to procure them from places that make this vaccine and produce it. Yes, and Canada is not one of those places at present. Those places are in other countries around the world, and it looks like we are being sent to the back of the line with respect to the contracts that the Prime Minister and the federal government have signed that he had touted a couple of months ago. So the first way is to procure that vaccine. We unfortunately need to procure it from places that are not in Canada. The production capacity, the production capacity that we have, or the manufacturing facility, or the lack thereof in this nation, is a problem, and it's one that Saskatchewan has been advocating for not just the last number of months, but the last number of years with our federal government to invest in our Vito Intervac, or our Vaccine and Infectious Disease Organization, right in Saskatoon, who does have the expertise to do this work, and all they were short of was a federal partner in funding to do this. I would point, and we will provide you with a letter that's dated December the 4th, 2017. It was penned to the Western Economic Diversification Funding in Canada, to the Assistant Deputy Minister there. It was written by our Chief Executive Officer of Innovation Saskatchewan, and I'll quote from that letter, and we'll provide it after this news press release. I'm writing on behalf of Innovation Saskatchewan to express support for the Vaccine and Infectious Disease Organization, or the International Vaccine Center's proposal to establish the Western Canadian Vaccine Manufacturing Facility. This ask was in place in December the 4th, 2017 to the current federal Liberal government. It goes on to say that Innovation Saskatchewan is prepared to make a financial contribution towards the establishment of this facility. This ask has been with the federal government not only for the last number of months, but for the last number of years. Yes, they came forward with some funding here recently, which is helpful. They've also funded to a much larger proportion a couple of other manufacturing facilities in Canada. Saskatchewan received much less funding than a facility in Montreal, but this funding is late. It was asked for a number of years ago, and we would have asked that it would have been considered at that point in time. That being said, the work that is happening at Vito Intervac may be ultimately our access point, because it doesn't seem that the Prime Minister's procurement contracts that he has with these other companies are going to come through in the way that he had first indicated to Canadians publicly, but also to through the Ministers of Health and through our deputy ministers to provinces more recently, as far as our allocations will be. As I said in my comments, Minister of Health was on a federal provincial territorial call last night and didn't receive the answers to the questions that he had asked.
We have time for one last question in the room, Marty.
Yes, sir, I got a couple, but can you tell us why there was really no addressing high schools like we saw in Alberta? Why you went in a different route? And before I forget, there's a lot of people who have been asking about your health, Mr. Premier. Can you give us an update on your COVID test?
Sure, I will allow the doctor, if you want to talk specifically about these schools, first of all, we have made some changes in the days recent past with respect to high schools, but you can speak to the rest.
Thanks. So, we have detailed discussions with the Ministry of Education and with all school divisions on a weekly basis. So at this time, when we look at our cases in schools, most of them are single cases that are imported from the community, very few clusters or outbreaks. So based on that, we are confident at this time that we can complete the school year and go into a regular Christmas holiday period and then resume at the appropriate time. And we also hope that the measures today, especially the pause for sports teams, will further reduce the importation into schools, so that it will relieve the pressure. And finally, some of the measures around larger high schools going to hybrid has also relieved the pressure in some of those settings. So we hope all these measures will allow, really important sector education for school children to continue in class and to complete their fall term, have a normal holiday break, and then resume in the winter. But obviously, some other provinces may be making some other adjustments to that, and we would continue to work with our partners in education and school divisions to see if there's any changes that are required.
I'll maybe just speak a little bit to why I'm at home and not there with you today. About 10 days ago on Sunday, my wife and I were in Prince Albert. We were cross-country skiing. I had lost an aunt the day previous that lived in Prince Albert, and upon completion of our cross-country skiing, we called my cousins and my uncle, my widowed uncle, to see if they were around and available. They were heading to a restaurant in Prince Albert for a bite to eat, and so I took the opportunity to pay my regards to my family members on the loss of my mother's only sister, and then was informed later this week that there apparently was a staff member at that restaurant that had tested positive, and there was some fairly extensive contact tracing that was occurring. So we immediately self-isolated, got a test before we even came home, or on my way home. I was able to get a test. I haven't had the results of that test provided yet. I would hope and expect that it would be negative, as I feel quite fine and as normal as I suppose I will ever feel. But most certainly we will see our self-isolation through till Sunday, regardless of the test results, and follow the public health advice that is being provided, as we would hope everyone in the province will. So, feeling good, hoping for a negative test result, and then hoping to see all of you soon. As odd as this may sound, I miss not being there today.
Do you have a follow-up, Murray?
Well, first of all, condolences, Mr. Premier, on your loss. And just to clarify, Dr. Shahab, does that mean that it will be up to the school divisions to employ what they see necessary? What is the triggers for them to change? In essence, are we going to see every second day for high school students that we're seeing in the larger centers, for the larger schools, for a continued time? Can you offer some guidance, and specifically as to how it relates to how teachers and other people in staff can more effectively protect themselves?
Yeah, so at this time, ever since school started in September, schools are functioning in a way that's, quite safe, and they have had increasingly over the last 3 weeks more instances of a single case in a school and very few outbreaks. We always expected to see a single case in a school and very few outbreaks, but the last 2.5 months have shown that all the layers of protection that schools have protected them from large transmission events within the school, and most of the cases have been importation from the community, and as community transmission goes up, importation to schools goes up. So the number of schools who are notified on a week-by-week basis goes up. With the measures announced today, we hope that the instances of or numbers of times that a school has a case will stabilize and go down. That should allow schools to complete the fall term as per routine and go into winter holidays. But obviously we consult regularly on a weekly basis, and if there's any ongoing concerns, we can certainly look at guidance or my recommendations to the schools. They are in touch with local medical officers of health as well, and if any changes are required locally or provincially in the school program, that can happen as well. But at this time, it's been challenging for schools, for parents, for children, for staff and teachers. We cannot underestimate how challenging it has been to, occasionally have a child who may have come to a class and then a few students in the class have to isolate, or the whole class has to. It's been an unusual time, a challenging time, but I think so far schools have done extremely well, and the credit really goes to the teachers, the staff in the schools, the parents, and the children themselves who have been following the protocols, wearing a mask where required, not going to school while sick. So far, school reopening has been very successful. But again, like all sectors, we continue to watch very closely and support them if any change in guidance would be required.
Dr. Shahab's comments about the school divisions, towards how the administration, how that relationship with not only Dr. Shahab's office, but the local medical health officers has really been strong throughout this process. I think despite increasing community transmission levels and a number of cases arriving in our schools due to good and appropriate planning by the school divisions and consultations with the Chief Medical Health Officer's office and their local medical health officers, I think there's been sound plans in place. And as Dr. Shahab said, a real credit and note of appreciation and thanks to our educators across the province who have gone once again above and beyond to keep their classrooms and their schools safe, and a shout out to all of the kids that are doing things in a very different manner, wearing masks wherever they go, and just doing alternate recesses, all sorts of different things that are occurring. A great degree of thanks goes out to the actual students in our schools across the province. They're doing collectively doing a remarkable job, and for that we're very grateful.
And that concludes our time for today. Thank you very much for joining us today, everyone.